Is one very interesting point is that a lot of institutions, depending on where they're at or who they're with or whatnot, can be very difficult for an LGBT uh, elder and senior to deal with. It can be very hard because you may have someone, I have seen 70-year-old transgender patients, they came out in the 90s and have been transgender and identified. Is that nursing home gonna respect that? You wanna make sure, or that assisted living, or are they gonna give them a room and assign them, to the gender they were born with instead of the gender they identify with, right? Um, are they going to be able to live with their partner, if they both go? Sometimes a couple, might go move in together to an assisted living. Is that gonna be a problem? Generally these days, that's not, but it's always something very important to talk about. Is someone as they get older, actually, as speaking of LGBT care, it's important to make sure that everything is planned in advance because sometimes what happens is if you're not married to someone that's specific, if you're married, because of the marriage laws, that trumps things. The spouse is the top decision maker for you. But then what happens is as someone, if you're not, then you might have children. You might have siblings or other people who come in. And if you're debilitated at the end of life, they may try to make decisions that you wouldn't want. Years and years ago, I had a patient. She actually wrote on her advance directives, I do not want to go to Texas with my sister. And she put that in black and white on her advance directives. I laughed. It's like, "Oh, that's funny. Oh, that's great." Until the sister showed up. The sister showed up and wanted to bring her back to Texas. I'm like, "I have an advance directive form." Of course, the sister's like, "Oh, that's all. I have a new one." And well, the patient had a stroke. Her memory wasn't very good, and so her decision making wasn't intact. And the sister went to the facility and said, "I'm the sister. I'm the next of kin. I'm going to take her to Texas. I'm taking her to Texas now." And I had a big old meeting. I said, "You can't do that. You can't override this power of attorney because she's not decisional anymore." And the sister grabbed the wheelchair and was like, "I'm taking her." I, in one of these moments that I got in the door jam and I got in her way and I said, "You are not the power of attorney. That paper is not valid. You cannot make decisions for her. If you leave with her, I will call the cops and have you arrested for kidnapping." Thankfully, I didn't actually have to follow up on that because she just turned back around, and eventually a judge determined that the sister was not the person and that her partner was her rightful decision maker. But the moral of the story is again, with dementia, as the memory starts to go and stuff, especially if you're in the LGBT community, you need to have a conversation earlier than later about who is important to you and who gets to make decisions for you.